Studies have found that 50% of lifelong mental health issues begin by the age of 14. Yet, most mental health initiatives focus on secondary education teachers, teenagers, and adolescents.
As we know, prevention of emotional and behavioral disorders continues to be a key global public health priority. It is well documented that evidence-informed psychological, behavioral, and social approaches significantly contribute to positive mental health, reduction of risky behaviors, mental disorders, self-harm, and indeed suicide. Though existing studies have highlighted that over 50% of mental health problems begin in childhood, our observations reveal that most mental health initiatives tend to focus on secondary education teachers, teenagers, and adolescents.
According to PAHO, the region has a critical public health gap. The organization anticipates that launching its Promoting Wellbeing and Mental Health in Schools handbook for primary schools will significantly decrease that gap.
Children spend a good part of their daily lives in schools. Therefore, including initiatives aimed at improving mental health literacy during children's time at school becomes a key strategy, particularly as it is imperative to establish the foundations of mental health, promote well-being and socio-emotional development at an early age.
Conditions such as ADHD, anxiety, behavioral problems, and depression are the most prevalent mental health conditions in children. In some cases, those diagnoses are combined. Increased mental health literacy within the region's primary schools can help to decrease stigma and advance the understanding of teachers and students, says PAHO.
Mental health literacy aims to really decrease stigma around mental health conditions and increase the understanding of teachers, but also students, on how to optimize and maintain good mental health and also improve help seeking. We all know that the quality of the environment where children and adolescents grow up shapes their well-being and their development. Supportive parenting, a secure home life, and a positive learning environment in school are the key factors in building and protecting mental well-being. We all know that early negative experiences in home, schools, or digital spaces, such as exposure to violence, mental illness of a parent or other caregiver, bullying, poverty, they increase the risk of mental health conditions. The school environment offer a unique opportunity for early identification, prevention, and also for delivery of interventions.
The handbook is designed for easy learning for the teachers and the students, with interactive illustrations from cover to cover. The knowledge and skills in the guide will equip all levels of educators with critical tools to support the mental health of students. They can manage difficult classroom behavior and promote students' well-being and academic success.
I do want to highlight the fact that the handbook's title is Promoting Well-Being and Mental Health. So we're talking about recognizing mental illness and about learning to do something about it, but also the handbook is aimed at promoting mental health, which is much more than just not having a mental illness. It's really developing ways of interacting that are going to be useful as ways of living in the world in an adapted way. And that's what well-being is, and that's what mental health is.
Reporting for News 5, I am Paul Lopez.